Welcome to SHOEM online course BES 127 Assessment for Learning. So you are currently in 10th week and also in the 10th module, that is identification of learning gaps and corrective measures. I will be discussing with you about the diagnostic testing and remediation, and what should be the role of teacher and the strategies the teacher should adopt. So today what we are discussing, that is the diagnostic testing and remediation, areas, role of teacher and strategies. In this discussion, I will be focusing on the process of diagnostic testing, how we will do it, the process of remediation, and what are the remediation strategies the teacher should adopt. Let us come to the discussion now. So we talk about diagnostic testing and assessment. We need to understand how diagnostic assessment assists teachers to gain understanding of current situation. As you know, diagnostic test is used when the student experience some learning difficulties, some learning challenges that create a gap in his learning, and this gap gradually becomes bigger and bigger. Unless you don't diagnose it, you don't start the intervention. So it's very important. Diagnostic helps the teacher to understand the current situation, why the student is not performing well. Further, you gain the knowledge about how to improve. If you are able to identify the underlying cause, you could identify as because of this the student not doing well, and based on you can develop required resources. That resources can be your counseling session, that resources can be drill, that can be your resources can be remedial lessons, it can be in many forms your resources. So the three things: number one, understanding the current situation of the student, knowledge about how to improve, and the required resources that will set you into action. With the three things, you will be get ready for action that is going to improve the learning outcomes. So if the learning outcomes improves, so naturally the learning gap will reduce further and further, and you will be able to remove the learning gap. Some action may take smaller duration, some action may take longer duration. That's depend on the problem. If you delay in understanding the student's current situation and you fail to know, you fail to understand how to improve, and if you don't have resources, I think you cannot help the student further. So these three things are important. You need to remember if you want to remove the learning gap. The diagnostic testing and assessment process, you can call it diagnostic testing, you can call it diagnostic assessment. It's a process. There are different types of activities you do during this process. Let us examine how these processes contribute to the diagnostic assessment. For example, screener, the screening tools. There are many screening tools available, whether the screening tools for identifying computational error, arithmetic error, tools for identifying the spelling error. There are many screening tools are there. They are quick, and it provides you whether the student is suspected to have a problem or not. These screening tools you can use with all students, or maybe with group of students you identify suspecting that they have some problem. So these screening tools provide brief information about all students to show which ones have low scores compared to grade level benchmarks. So if somebody is obtaining low score, then you can understand, yes, the student has some problem with his learning. What should be the grade level benchmark and what student is achieving? This screening tool the teacher can develop, or there are standardized screening tools. It should not have many items, very few items, and these items should be able to find out whether student is achieving low score when compared to his grade level benchmarks. So screening is one part of the assessment. Second is classroom observation. The teacher observes the student's classroom behavior and the efforts in performing the academics, is performing various learning activities. It's very, very critical and very, very important. It's very complex process, classroom observation. So as a teacher, you need to have a close observation of every student, So your observation is the student's interaction with the peers, with the teacher, students' interest in the subject, the student performance, how the student is doing some certain academic activities. And even the peer also can sometimes provide you the information also. Peer, parents, those also need to combine with your observation. If you make a good observation, you can identify lots of important information about the student. So that's why classroom observation is must and is a part of your assessment process, is a part of your diagnostic testing, observation. So what you are going to observe? You are going to observe, number one, the student's cognitive abilities, intellectual abilities, the student's intellectual ability in terms of reasoning, memory. There are many domains of intellectual abilities. You need to observe the student's motivation. You need to observe the student's concentration, attention. You need to observe students' social relationship, students' peer behavior. You need to observe the students' family environment. But the problem in the family, the parent-child relationship, these are also very important. To make your observation more and more valid, you can interact with the student, you can you can interview the student, you can interview the parents, that you can add on with this, if you think that is going to help. Next is qualitative data. It's not important what score the student gets. It's not important whether the student got 3 out of 10 or 4 out of 10 or 5 out of 10. The more important, what are the qualitative data that talk about the student's skills and performance on the classroom assignments. If he is getting 4 marks out of 10, it's because of he is committing lot of spelling errors, or he is not able to describe as required, or he is making some other kind of errors. That information is more important than merely a score. Score is just to know what is the performance level of the child, how the student is performing, what are the problems. There you need the qualitative data. This is very important, the qualitative data. So qualitative data can be maintained by the teacher. As a teacher, you can have your diary. You please note down about the students' information. If I give an assignment, you are given some test, what are the mistakes, what are the errors the student doing, you need to keep on noting down so that you have required information to diagnose the student's problem. Then comes the diagnostic test. Till now, you are much aware about the student's problem. Then you are able to identify which diagnostic test I can use. There are many commercially available diagnostic tests. Whether you want to use arithmetic diagnostic test, you want to use the reading diagnostic test, you want to use the whatever the student's problem, you want to use that kind of test. This test provides in-depth details about student skills in specific domain. Mathematics, letter sounds, phonetics, whatever is of your concern. It means you make a detailed testing of the student in the concerned area where the student has difficulty. And that provides you a very good report, a profile of the student's problem, where exactly the problem is. And then you measure the progress. So once you have done the testing, as you know, then you start working on the child, on the student. You start the remediation. And this remediation and testing also go hand by hand. It's a continuous process. As the student progress, you keep on assess whether the problem is getting resolved, getting minimized, or it is increasing day by day. So with the progress measure, you are able to diagnose, you are able to provide a prognosis how quickly or how much time the student needs to resolve the learning challenge that he has. So it means it follows a complete process. So as I have already in my discussion have brought the two things into place. One is standardized, one is teacher-made. As a teacher, you develop many achievement tests. Your achievement test on, for example, history, for example, taught a lesson. Whether student has learned something or not, you can assess through you make some questions, you make a quiz, you make whatever you want, you make it. So you are much familiar with teacher-made test for assessing achievement. For the achievement of history, achievement in mathematics, achievement. But diagnosing a problem where the underlying cause is for which the student not able to perform, making that test is really challenging, really difficult. As a teacher, you have a good years of experience. You have been identify the student's problem, the causes. You are very familiar with this. So with your good knowledge and experience, you can make a diagnostic test. For example, a test to identify spelling error. A test to identify whether student is doing, problem with carrying over of mathematics sums, or the problem the student is doing of copying something, or the problem with the phonetics. You can do. As a teacher, you can do teacher-made. There are certain things. For example, you want to identify why this student is not able to read and comprehend. He has a very severe reading problems. Where the problem is written CAT. The student is reading many times CAT, but not able to combine it. CAT is cat. He is only able to see CAT. So if you want to diagnose the perceptual problem, you want to diagnose some kind of very, very complex problem, then I think you have to go for standardized test. These are available, commercially available standard test. So then, based on the student's problem, based on your competency, based on the availability, you have to decide whether you have to go for a standardized or you have to use your fellow teachers made test. Means maybe your colleague might have done some test. So you as a teacher, so you know the teacher made test. If you are able to make it, that's good. Otherwise, you can ask your colleague, and with your fellow teacher, you can also borrow if they have made some kind of test. You can use that. That doesn't mean that you have to make all the tests. And sometimes standard tests are not available. It's very difficult and maybe very expensive. What you will do? You are not going to find out what problem the student has, or you will just wait months to come, years to come. Whenever you will get a tool or test, then you will be able to do the diagnosis. No, don't wait for much. But your result made by teacher-made test, you have to use it with lot of precautions. You cannot just generalize it because it is not a standardized test result. It is just to provide you some kind of your, the test you have made that may not be a very precise, but that helps you to identify the student's, the cause of the problem. That's good. But that test report or test result has to be used with much care. In case of standardized test, the result depends on the setup, the environment, the steps, as it is in its manual, how you have used it. That's very important. So don't think just administer a teacher-made test, standard test, whatever the result comes, that is final. No. You have to correlate with your observation. You have to correlate with all kind of your observation, interviews, or whatever you have done earlier, that need to be taken care. When you want to, once you have done, then the next step comes your remediation, and for that you have to develop a remediation plan and implement it. Your remediation can be individualized, it can be group. If you have many students having similar problem, for example, you have about 7-8 students having problem with the spelling, you can have group remediation, you can have group drill, you can do this in a group setup. And group setup is good in terms of your time is saved, because if you work individually, then you have to spend much time. Then in a group, many times the students also do well. They don't feel isolated. They don't feel labeled. You have to take care of labeling. If you are pulling out the student from the class for remediation, it should not give an impression the student has learning difficulty. The student has some kind of problem. This will not help. You have to always create a positive. You have to motivate. That should not lead to any kind of labeling. So that means the group remediation is the most convenient, is the most economical, but there are certain problems that needs personalized learning support. This personal learning support can happen in the class, during the period, during the teaching learning process, while giving attention to a particular student on a particular point. This personal learning support can be happen during the end of the class. Just spend 2 minutes with the child. Yes, what you have done. I just, like you have called 2 to 3 students, may not be all the time that student only. You can call 2-3 students, okay, come and discuss with me or do something. It means end of the lesson, you are providing some kind of personalized learning support. Or maybe you may need a special space, maybe in your chamber, maybe in your cell, maybe in your room, you have, or in the school resource room, you have invited the child to provide personalized learning support. So personal learning support can be given during the instruction, that can be given end of the class, the same day, same class. It can be given end of the unit in the same class, and it can be given out of the class, that is in the resource room. That's the personalized learning support that you can provide. And for as you have identified the cause, identified the problem, what are the factors that is really causing the problem, your remediation plan should be based on that. You may have number of drills, number of activities as the problem requires to be resolved, that you need to have. Then more important is response to intervention. You have to give time to the student. Let us understand Tier 1, Tier 2 and Tier 3. Tier 1 is all students receive instruction on the core curriculum. You don't pull out the student to provide the personalized learning support. They remain in the same curriculum, in the same classroom, but you provide support which is individualized in the classroom. Tier 2 is the student who are below grade level receive additional instruction in small group. So you may pull out in a group form, small group, you provide some enrichment programs or remediation program. Tier 3 is student who are unresponsive to Tier 1 and Tier 2. They receive individualized instruction. So for Tier 3, it could be required for very, very few students. If you really concentrating on Tier 1 and Tier 2, you can provide good remediation within the classroom without pulling out the child from the classroom. And try to understand that pulling out can lead labeling and it can interfere with inclusion of the student. So we'll just summarize what we have learned from this discussion. Diagnostic assessment assists you to gain understanding of students' learning challenge. That we have understood. If we are using the screening tools, we are using the observation, we are using the various diagnostic tools, we are able to gain understand of the students' learning challenges. Diagnostic assessment can be well integrated into curriculum on regular basis. Even if whenever you start a lesson, when you are in a progressing the lesson, you can have diagnostic assessment in between. Try to understand. If the student in a formative assessment, if some student is getting low score, why they getting low score, then there itself, you can introduce the diagnostic assessment. Find out and start intervening there itself. So it means it can be well integrated into curriculum on regular basis. Third point, diagnostic assessment follows a logical process. Screening, observation, testing, planning, and even you find out the diagnosis during progression also. So it is following logical process. Number 4, diagnostic assessment can be done through standardized as well as teacher-made test that you have well understood, and if standard test not available, then we can make teacher-made test and vice versa. And teacher-made test can be, if the problem is not very challenging, not very complex, you can use a teacher-made test. Personal learning support, group remediation need to be done based on the diagnostic report. Whatever the diagnosis you make, based on that, develop plan for personal learning support and group remediation. And last not the least, intervention follows different tiers. Tier 1, that can be possible within the classroom with a support. Tier 2, that is in the small group. And Tier 3 only require for very, very few students for whom you need to provide the individualized learning support, individualized educational or remediation activities. I think you have understood, and wish you all the best.